Hello students, we continue with our lecture series on the pelvic viscera. My name is Dr. Ominde. So today I'll begin with the innervation of the pelvic viscera. So pelvic viscera are innervated by sacral and coccygeal spinal nerves and the pelvic part of the autonomic nervous system. So each nerves S1 to S5 divides into a dorsal and ventral ramus within the sacral canal. So the dorsal rami of S1, S2, S3, and S4 will pass backwards through the dorsal sacral foramina, while the dorsal rami of S5 and coccygeal nerves will emerge from sacral canal through the sacral hiatus. The ventral rami, on the other hand, of S1 to S4 will emerge from sacral canal through the pelvic sacral foramina, and S3 and S4, occasionally S2 or S5, will also give pelvic splanchnic nerves that are components of the autonomic nervous system. So we have different nerves to the pelvis. These are the nerves that will innervate the muscles within the pelvis: nerve to piriformis, nerve to levator ani and coccygeus, as well as nerve to the external anal sphincter. Then we also have pelvic splanchnic nerves that carry parasympathetic, preganglionic, and sensory fibers which supply the sigmoid colon, as well as pudendal nerve that innervates the perineum and gives motor and sensory fibers, postganglionic sympathetic fibers. So the pelvic part of the autonomic nervous system has sympathetic nerves that reach the pelvis through the continuation of the sympathetic trunk and the aortic plexus. The lymph nodes of the pelvic viscera, we have sacral lymph nodes that lie in the hollow sacrum, and these receive vessels from pelvic, perineal, and gluteal regions. They drain to the internal iliac nodes, later into the common iliac lymph nodes. The internal iliac lymph nodes are arranged around the internal iliac artery, and these receive lymphatics from pelvic viscera, perineum, and the buttocks, and usually lymphatics from the internal iliac will drain into common iliac lymph nodes. External iliac lymph nodes are along external iliac artery and receive superficial and deep inguinal nodes, some pelvic viscera and abdominal wall below the umbilicus. They usually drain to the common iliac lymph nodes. Common iliac lymph nodes receive lymphatics from external and internal iliac lymph nodes as well as the sacral lymph nodes. Common iliac lymph node drain its lymphatics into the lumbar group of nodes. The ovaries and fallopian tubes drain to the lumbar lymph nodes, while the upper part of the body of uterus drain to the lumbar nodes. The lower part of the body, as well as the cervix, will drain to external nodes. The vagina drains into the superficial lymph nodes at the lower part, and the upper part of the vagina drains to external and internal iliac nodes. The middle part drains into internal iliac nodes. The testis and the epididymis drain to the lumbar lymph nodes, while the seminal vesicles and ductus deferens drain into external iliac nodes. The prostate drains into the internal iliac lymph nodes mainly, and also to sacral and external iliac nodes. The scrotum, however, drains into the superficial inguinal lymph nodes. The penis and the skin with the prepuce drains to the superficial inguinal nodes, but the glans, penis, and clitoris will drain to the deep inguinal nodes, which are called the cloaquet nodes. The ureter drains to internal and external nodes, while the bladder drains to the external iliac nodes. The neck of the bladder drains to the sacral and common iliac lymph nodes. The urethra drains mainly to the internal iliac, but also to the external iliac lymph nodes. The rectum drains to the inferior mesenteric lymph nodes on its upper part, and the lower part drains to sacral lymph nodes as well as internal and common iliac lymph nodes. The anal canal above the pectinate line drains to internal iliac lymph nodes, while below the pectinate line, the lymphatics go to the superficial inguinal lymph nodes. That's the final slide on pelvic viscera. So just go through the slides again, and if you have any questions, you are allowed to ask. Thank you very, very much.